Well, hello, everybody, and welcome to another episode of Faith Greater Than Fear. I'm here in Joplin, Missouri with GMPI, and from time to time, we take an opportunity to interview people that are from all walks of life, and whether that's from the business community, whether older people, women, men, students, all kinds of people, just like you and me, because we want to know how they're coping in this very unprecedented time. And so today I've got a really great episode up because the lady I'm going to interview is none other than my wonderful wife, Carolyn Schrage. Carolyn, welcome.
Thank you.
Yeah. So in these episodes, what we're wanting to do is just really tell our audience and our viewers a couple of three things. And first is just how are things personally, you being affected by the virus and its impact right now?
Well, I think for our family, as being a mom and a wife and a grandma, obviously we're handling the things the same way that every other family is, with just that disappointment that we don't get to sit down and have a game of Scrabble with my parents, or get to invite our kids up for the weekend and have lunch together. Don't get to have all of the hugs from all those little grandbabies. So from that point, it is. It's a disruption from our norm and from what we love to do as social Christian families. But I think it's also given us an opportunity to really be thankful for technology that allows us to be able to have those Zoom meetings with our kiddos and get those little videos of our children, do the Facebook kind of interactions, and have that live FaceTime. So, we're all figuring out what that looks like. I think for those of us that grew up on the mission field and or served with our families a continent away, we kind of know what it's like to do some of that distancing when it comes from maybe a home church setting or from our loved extended family, because we only get to see them every 3 years or whatever the case may be. So it's just kind of a version of sometimes what it takes to assimilate to what the cultural expectations are and what you have to do in season and out.
And so, good point. So basically, if our audience have got people that live on, if they're in the Midwest and they're living on either the coast, or they have kids that are serving companies overseas, or like you said, have missionaries that are serving overseas, they get to kind of feel a little bit of what it's like to be really, really separated physically right now. So really want to get really quickly into what you, Carolyn, lead, what ministry God's called you to, and how that has been affected, and what you're doing in those arenas right now in this unprecedented time.
Well, our ministry is one that is centered around healthcare and around medical services. And so we provide a safe space where young men and young women really can come and contemplate any kind of a sexual health crisis that they have, be that an unplanned pregnancy, maybe that is a sexually transmitted infection or disease. So our particular staff is focused on making sure, no matter what the crisis, no matter what the concern is, that we have that safe space. So we have a holistic approach that makes sure that we are really, as healthcare professionals, integrating what medicine is supposed to be all about, and that's having that physical, that emotional, and that spiritual component of providing care. Now, we get to have the opportunity, because of the way our organization operates, to be able to point them to that ultimate caring. But so we are used to having those individuals that come through our clinic doors that are facing crisis. It's just this particular viral season has made that exceptionally challenging for our staff, because we're having to make sure we are not only taking care of those that come in the doors, but we're really working hard to protect ourselves and to protect our team so that we're not exposing and or being exposed. We're very responsibly responding in this season. And, I love the quote that Mike, you actually shared with me from Tozer, that just said, a very scared world needs a fearless church. And so that's what the front lines of our organization does, we are a ministry that is choosing not to be reckless. So we are very careful, but we have those challenges of having that PPE and having enough masks and having enough disinfectant. And we've changed up all of our protocols in how we're walking to the cars, and we're making sure that we've done all those pre-screening texts before someone ever even enters into our facility. But we've taken 50% of our medical staff and rotated them home on leave with pay, and they're working from home. And then the other 50% of our medical staff is in the building. So we're rotating that out, not only for the quarantine aspect, but also for our own self-care, soul care, to make sure that we're ready to face that next challenge.
Yeah, and I want you to unpack even a little bit more. So you've got half the staff probably serving even more clients or people and having to do it in very careful, very methodical ways. We haven't had a lot of opportunities to talk with a lot of medical people yet. Tell us a little bit about some of those steps, some of the stresses, and why you feel that this is, in your clinic ministry, a critical service yet. What are the clients thinking about in this particularly stressful time in their lives when you see them walking in the doors?
Well, I think that the general health care that someone has to face each day doesn't change just because there's an added stressor of a virus. So we still have those that have that pregnancy and maybe have an unplanned pregnancy. Where it makes it especially critical, especially in our world, is that when someone is faced with so much of the chaotic confusion that is sometimes projected on the media, the idea of bringing a child into the world right now is just overwhelming. Or if you're one of those families that suddenly has lost your source of income, either you're already a single parent or perhaps your husband has lost his job, the idea of feeding one more mouth is really suddenly shaking up families, and they're going, I can't have this unplanned pregnancy, or I can't fathom what to do now. So in those kinds of situations, we have to be there to provide that calm in the middle of the chaos, to be that compassionate response that knows that in our country there are choices, but we want to make sure that people really understand that they're making an informed choice. And so providing the pregnancy tests, making sure that we're giving all of the accurate information, understanding that other healthcare entities, they are not closing down or shutting down their business. And so we need to be there and be proactive to give them the ultrasound, to let them know how far along they are, to give those referrals to the OB-GYNs, to understand that they've got to get their insurance status started. There's just so many things that delayed healthcare at an OB office because they're pushing this off doesn't mean that our clients don't need to get that early intervention, that early detection of their pregnancy. And it's the same with those that do have a sexually transmitted infection. We have a very unique partnership with the Missouri Department of Health. And so we've already got that connection where if they have positive or known exposures, they refer them to us in our corner so that we can get them the critical and vital treatment that's needed. Right now, many of our public health disease infection specialists, they're having to really focus on the COVID exposure and focus on the pandemic at hand. So they really are relying on facilities like ours to stay open so that they can refer some of those other individuals that need treatment to us. So for example, the other day, we got a call from the Jefferson City head just basically saying, there's a young pregnant mother in your area. We can't get a hold of her. That mother needs treatment for syphilis so that the complications that are deadly to her unborn child will not result in congenital syphilis that can result in death. So we were able to take our mobile unit, tap in with one of our security volunteers. We were able to mask up to be able to go out in the community and try to track this person down and to get them that vital life-saving treatment. So it it is a challenge and it is extremely complex. But if you're already facing one health challenge, you can't suddenly just be stopped because there is another pandemic. We have to treat those that are still needing the treatment that is vital for their health and for the health and protection of their unborn child.
Wow. So if I summarize three things, one is that ladies who are having a pregnancy concern, the economic additional pressure and that surrounding it is in this season causing more concern. Number two is that there is this sense that other medical facilities are saying these aren't quite as top priority. Not that they're not important, mind you, but we've got these other emergency kind of things to take care of. So could you, Choices Medical, take care of those for us? And then thirdly is this kind of idea that, is my child even going to be well during this season medically? And so all of this together says to your community of clients, yes, you are very, very essential. The biological clocks don't stop just because there are some economic overtones or so forth. Wow. And you alluded to the fact that you have brick and mortar walk-in, but you also talked about a mobile clinic. And I want you to unpack that just a little, because there was a colleague of mine that said, Mike, at this time, we don't need to look at the church not having the ability to meet on Sundays as a step down, but that this really gives us an opportunity to step in and step forward into our culture more than ever before. And I think the mobile clinic would be a brilliant example, an illustration to our audience of it. Can you help us with that just a little bit more?
Sure. We've got the ability with our mobile unit to be able to go directly to a location where there may be someone that needs a vital ultrasound or needs vital treatment in this season, and maybe for whatever reason, they are not permitted to go someplace else. So it's not an active 911 ambulance type setting, but it is one of those things that we can very specifically reach out and target if there is difficulty in someone getting to us. And so, while our routine to go into the jails to do testing has been somewhat suspended because of the quarantine of jails, or even our regular routine where we're going into domestic violence shelters or into the drug rehab, a lot of those places are now on lockdown. So our mobile unit team has been sort of redeployed to stay at home, so to speak, and is functioning within the clinic, but we still have the capacity with our partnership when called upon to be able to respond in a different way than maybe what we've been used before. We're used to, at our clinic, being those first responders for the sexual health concerns. We're just having to reimagine what that looks like. So our regularly scheduled presenters that go into the schools now, that's not an option because schools are closed, but that's not stopping us from doing some of the virtual learning modules that can now be accessed by our public health, or by our public schools. The same with our online parenting. They can't come in for a physical gathering, but we've been able to take all of our parenting classes and offer those online so that young moms and young dads that do have a lot more time on their hand, they can access those classes and get the vouchers that we offer for diapers and wipes. So they're still incentivized to be doing brilliant learning, learn how to be great moms and dads in this season, and access even budgeting, some life skills, just certain ways that we hadn't done before that we're now imagining out of the box. So we're not stopping any of the services, we're just reimagining how we're doing that. Are there challenges? Absolutely. But I think our team has the mindset that we've been called into battle every single day to be that justice response for the voiceless victim that is in the womb, or that voiceless victim of sex trafficking. And where our organization is able to step in, we see ourselves as in a battle, that we are to be warriors and we're to be geared up each and every day. And with that mindset means we have to be connected to the source, and we have to be infused with all the gearing up and the emotional fortitude that it takes to get out and get on the battlefield. These are just exceptional challenges that have added to, and so we have to defend against being warriors when right now we have to be even more keenly in tune with being warriors. And so that's where I am so blessed to be the leader of a team that does see themselves as warriors. And, you know, when my warriors have been voluntold that, hey, this is your 2-week time to stay home, you know, their immediate response is, oh, but wait, I want to be on the front lines. And we've had to reimagine and say, right now, you're the designated survivors that are staying home so that the team that's in the clinic can do what they're needed, and then you can rotate in and we can do battle from both perspectives. So it's as much a spiritual battle and emotional and mental, so that we can keep serving and we can fight the worry by concentrating on being the warrior.
Fabulous. And so I hope the audience have heard there in our whole episodes, every time we talk about, you know, faith is supposed to be and is greater than the fear. Here, Carolyn has talked about it is so natural in these days to be a worrier. And yet she explaining that because of being connected to our Father, there can be this switch and pivot to being a warrior. A warrior still can worry, but a warrior still lives out courageously because of their faith to overcome the fears. So in our closing minutes, Carolyn, what have you learned either personally or through your fabulous team that you would say to our audience today, this is the takeaway? These are the things that I'm learning afresh or continue to amplify in my life, these things that I'd love to share with our audience. What would they be?
You know, I think we're always called to be compassionate and to be caring. And so no matter what the cultural climate is, we have the ability to understand that we can continue to be that bridge between culture and Christ, where sometimes the church in its more traditional form is not able to penetrate a culture, but we can find creative ways where we are truly being that gospel whisperer. And we are seeking to see everyone in our culture, whether that's the state health department, that's our law enforcement, that's our mayors or our government that is trying to make difficult situations. We can see them as pre-followers. And we, as a compassionate tribe of Christ, we have the ability to pray and to speak into the situation with a kind and a caring attitude, no matter what the chaos may be. And I think we have to look at, as leaders in our homes and or in our ministries, in our churches, we have to go, okay, what is the course correction that we have to do right now? How can we pivot? How can we be adaptable? How can we be flexible? But it always means that we have to go back to the source. And so, you know, finding that strength in being a servant to one another. You know, I am a great recipient of my wonderful husband bringing me a frothy cappuccino first thing in the morning that starts my day out just exceptionally well. So even though I may feel overwhelmed or weary to face another day, I've been given that amazing pick-me-up right at the beginning of the day, or knowing at the end of the day, the person I'm coming home to loves me dearly and is going to distract me with a walk around the park, or even sitting down to watch a TV show together. Just that mutually encouraging one another and lifting each other up. And then I think going to the Psalms. There are so many scriptures in the Psalms, and I love the one that talks about, you know, even in adversity, we know that our spirit is not to be overwhelmed, but that we can lean on his hand who's going to lead us through no matter what. It is a season, and we will get through it. And on the other side, we're going to be stronger for having been a testimony to his faithfulness.
My dear wife, Carolyn Schrage, RN and Executive Director of Life Choices Medical here in Joplin, Missouri. Thank you very much for taking a little bit of your busy time to share with our audience. And for you today that are listening, we ask that you have been blessed again by what Carolyn has shared, and that you will, if you loved it, go ahead and tell others about it, either verbally or email or on social media, and let what she has learned bless others just like it blessed you and me as we listen today on this new episode again of Faith Greater Than Fear. Carolyn, thank you so much. See you at home. And for the rest of you, see you in our next episode. Bye-bye.